Hi, this is Sylvia Gordon. I was going to answer some more of your toughest AEP questions while in my chicken coop so that I can brag about my lovely chickens. I've raised these since April, so they're about 5 months old, and it takes them about 5 months to start laying. And this morning when I came out here, I have my first hen on the nest laying her first egg. She's in there clucking away, so I'm really excited. This is a great day, so in honor of that, we are filming in my chicken coop. So your toughest AEP questions. Does a person that has TRICARE for life need any Medicare products? So they don't need a Medicare Advantage. Now there are people that are pushing Medicare Advantage heavily to people that are on TRICARE. I don't think that's a good idea. They don't need it. And I actually think it's a disservice to our service people to put them on a Medicare Advantage. If you put them on a Medicare Advantage in TRICARE, and this is what people are saying, it's cool because they'll coordinate, they'll work together. So any co-pays you would have on TRICARE for life, the Medicare Advantage could pick up. So therefore, you can have fuller coverage and it's going to be awesome. Okay, it's not really awesome. Because if you have TRICARE for life and add a Medicare Advantage to it, now Medicare Advantage is primary. Okay, so now they have a network restriction that they might have had a much larger TRICARE for life network, typically much larger. The key here is that Med Advantage is primary, and they don't coordinate in the fact that one pays and then the other automatically pays. You have to coordinate the care, you have to submit the bills to the other to get payment. Don't do it. Leave your veterans and their families alone. TRICARE for life is fantastic insurance. They don't need it. My husband applied for Golden Rule and was denied because they said he had COPD. He does not have COPD. We have no idea how to correct this information with the insurance company. Okay, we've dealt with this for years, not just with Medicare, but with underage health insurance. And people say, I don't have this. Okay, a lot of times your doctor is really paternalistic and he doesn't tell you everything. You might have COPD or whatever you have. You might have it, but it's not bad enough that they actually have to treat it right now, but that you already have it. You have the beginnings of it, and it's a chronic disease. It's never going to go away. The reason your doctor didn't tell you, that's his paternalistic attitude. In the olden days, before electronic medical records, I always, when they put you in your waiting room and they'd have your file outside the door, I'd always grab my file and I'd read everything in my file before the doctor ever came in. You can't do that with electronic medical records right now, but chances are very great that this client does have COPD, chronic obstructive pulmonary disease, especially if he was ever a smoker. That's Pierre, one of my favorites. If he was ever a smoker, chances are great that he does have it, but he doesn't have it bad enough that he needs any treatment. So what you need to do is you need to call your doctor's office and confirm with your doctor, do you have it or not? Has it been put in your records? If it's in your records, it is never coming out. Now, there is a slim chance that there was an error and the insurance company thinks you have COPD when you don't. But like I said, we've been doing this for 30 years, and every time some doctor said that somebody put it in the records and didn't tell you, it's typically never been an error. Why would somebody want to buy a high deductible Plan F and not a Medicare Advantage plan? Okay, that's a really good question. High deductible Plan F, you're going to have to pay the deductible. So what it's like over about $2,200 a year. And then you don't pay anything for the rest of the year. People that buy a high deductible Plan F, typically middle to upper class consumer, what I've found is that it's generally pretty well-educated person that understands how it works, because the average person doesn't want to mess with understanding this. But a high deductible Plan F is a Plan F. Other than the deductible, it's a Plan F. And the key difference between a Plan F and a Medicare Advantage is network. No network. No, is my doctor in the network? Is my specialist in the network? Are the network negotiations up? Are they dropping in? Are they dropping out? Are they having a fight? What's going to happen? What's going to happen next year and the year after that? There's no network on a high deductible Plan F. If you can afford it, it's a great plan that most people don't even consider selling. because most agents don't even pitch it because the commission's so low. They say, I go broke if I sell that plan. No, you won't. You can make a lot of money doing the right thing by your client, especially your middle and upper class. And let's say you're a healthy client, high deductible plan F, they're not going to be scared of that deductible. Like I said, $2,200 around there, depending on what year you're watching this video. They're going to love the fact they can travel all over the country. They're going to love that they never need a referral to a specialist. They're going to love that their plan will never change. Because remember, Medicare supplement plans do not change every year like Medicare Advantage. High deductible plan F, sure, it doesn't make you much money. There's no shame in the fact that if you can't make money, you're not going to sell a plan. We're not in business to give away our services for free. That being said, you don't make very much on a plan that costs $50 or $60. But your clients are only paying $50 or $60. So they can afford to buy more wraparound coverage. They can afford a dental and vision plan, which if they're middle to upper class, they want. They can afford to buy a hospital indemnity plan. So if they do go into the hospital, that something can help pay that deductible. So cancer runs in their family. They can easily afford a cancer plan now. They can afford a cheap plan to bury them. So if you're selling a high deductible plan F, chances are you don't make much money on that plan, but you have enough money left over that they can buy some more coverage, get better global coverage, cheaper than if they bought a traditional Medicare supplement. They don't have all the restrictions that a Medicare Advantage would offer them. So that's a really good question. What do you do when you have your client in the best plan and it's AEP and the benefits stay the same? Okay, that's the easiest question. Keep them where they are. I mean, I don't know why you would possibly want to move somebody just to move them. What you want to do is you want to still get them on the phone for a phone consultation, have them come in for a face-to-face consultation. I call it your annual checkup, like your physical, and say, let's talk about it. Even if their plan that they're on, and I would say the majority of my people stay on their plan every year, you still want to talk to them about changes in the Medicare laws, changes in drugs. There's a lot changing in drugs every year, in the laws surrounding Part D, and new medications that are coming out, and step therapy, and everything that's been going on with Part B. And they probably never heard of Part B. They haven't had cancer, so they're not aware of these big changes in 2018 that happened with Part B drugs. It's a great chance to educate your clients to get a deeper relationship. Solidify that relationship, because remember, just because your clients have a plan and they've had you as their agent and they're happy doesn't mean they're not getting a ton of cold calls from all these huge call centers around the country. They're not getting people knocking on their door. They're not getting a huge pile of advertisements during AEP that makes them question, are they really on the best plan? So don't just be lazy and say, hey, my clients are good, there's not a better plan. Take that time to do that checkup, either in face-to-face or over the phone, to assure them why you want to keep them where they are. If I call someone for a Medicare supplement and determine they need a MAPD, what do I need to do? So if you get a lead for a Medicare supplement, yeah, he's really wound up right now. He doesn't like Jason in here. My rooster loves me, hates men. You know, it's a man thing. So you call a lead for a Medicare supplement, and you determine that they'd be better off with a Med Advantage. Okay, it's illegal for you to say, hey, you'd be better on a Med Advantage, because now you are taking that Med Sup lead and leading them to Med Sup, which CMS kind of calls cold calling. If the client asks you, we might just have to stop because they're like really upset. If the client asks you, hey, what about those other plans I see on TV? That's okay for you to start talking about it. But you shouldn't originate that conversation. If you do feel that that's the best fit for that client, and they have not originated the conversation, legally, they need to make an inbound call to you. So as much as this sounds like a crazy loophole, and maybe it is, you need to get off the phone and you need to tell the client, look, if you would like to talk about other types of Medicare plans, such as the Medicare Advantage plans you see on TV or the solicitations in your mailbox, I'm going to need you to originate the call. We're going to have to hang up. I know it sounds crazy. You need to call back in and you need to ask me. Okay, why don't we stop here because they're so loud and go in the other pen? Huh? Yeah, because they're like, oh, you want me to keep going? Do you think the sound is okay? Well, Pierre doesn't care. Okay. Yeah, I'll keep going with right there then. Oh God, now they're having sex. That's awesome. I'll say that. Stop that. Are you back on me?
Yeah.
You're on me?
Yeah.
Okay, we had to take a little pause there because my chickens were mating a little bit and I didn't want this video to go too X-rated, so that's over and I'm back. So we're talking about if your client calls in about a Medicare supplement, so that you had an ad in the paper or you sent a lead about a Medicare supplement. Now, 9 months of the year, you can't sell a Med Advantage anyway, and I would say the same thing. Have them call you back in if they'd like to talk about that, so you're legal, and then explain how Med Advantage works. They're not going to be able to buy it until AEP, but that's fine to go ahead and explain it now. I love when those people call in. It won't pay the mortgage, but you're getting somebody some extra time to really research and learn about it. I like to send them information in the mail, send them some emails, and tell them, look, there's no pressure to make a decision right now because you can't buy it right now anyway, unless something special would happen like you would move. So you're not going to be able to buy it until October. It won't start till January. Now, I can't even tell you what next year's plans will look like until October 1st. So I want you to make an appointment right now, the first week of October. Let's set it up so that you can call me then, or I can call you then, or we can meet face to face, and then I'll tell you exactly what next year's plans will look like. And basically you're filling up your pipeline for AEP. All of SEP, the people that you have that are interested in Med Advantage, that can't buy it, that's okay. You are the one that's talking to them. You're the one that has the first chance to sell them when the time does come. So you don't want to just zip by that person and go, yeah, I can't sell you Med Advantage. Give them that time. Say, you have months now to research it, talk to your friends, look this over. I'm going to send you some stuff. So you don't have to make a high pressure decision like most people do during AEP when they only have a couple weeks to make a decision. You've got months. Let's sell you a Medicare supplement right now. I know it's a little more expensive than you're comfortable with. That's not really a good scenario, but you get where I'm going. It's hard when you're talking from a chicken coop. Okay, more of your toughest AEP questions. And my little Pierre here, not saying a word. He's a rooster too, so he loves to crow, but he's one of my babies. Which online enrollment applications allow you to get a PDF of the application so that you as an agent can have a record for your file? And most of them don't allow that. Anthem does, and United Healthcare does. I have a client on disability, and she has a Medicare Advantage that costs her $76 a month. Within a year or two, she'll be on dialysis, end stage. Would you recommend a Medicare supplement when she turns 65? Yes. I love the easy questions. And oh, this is hard on my knees, Jason. I gotta get up higher. I got one of my chickens outside and she wants to get back in here. So would I recommend a Medicare supplement? Heck yeah. When your clients are on disability, typically they cannot get a Medicare supplement. So Medicare Advantage is their only option, which is a great option. It's better than nothing, which is what we used to have. But when they turn 65, get them on a Medicare supplement, the best plan you can, typically. Now there's people that have very minor disabilities, that'd be a different conversation. But somebody like this that does have end-stage renal disease, you want to get them on the most robust plan, no copays, no co-insurance. Especially if you're doing it right now, you can still get her on an F, or you can get her on an F and lock her in for life. DSNP, dual special needs plans. Let's say there's no dual special need plan available in my client's county. Will it negatively affect her if I just enroll her in a zero premium MAPD? No, it's fine. Agents are often confused by this, that if there's not a special plan, a DSNP filed in that county, that a client that's on Medicaid is not able to buy a Medicare Advantage. They can buy a regular Medicare Advantage. they'll be subject to those co-pays, and they'll still be on their Medicaid. When enrolled in a D-SNP, how do they coordinate? Okay, they coordinate. You don't need to know how they coordinate. Don't worry about that one. If a doctor is not in a D-SNP network, Pierre. If a doctor is not in the D-SNP network, but the doctor takes Medicaid, can your client go see that doctor anyway, and the doctor just bill Medicaid? Yes, they could. Doctors don't like the extra billing, but he still could do that. Okay, if they are paying Part B, reduced because they're not fully on Medicaid, could the carriers offer to pay their Part B? Yes, and some carriers do. Okay, this is a common agent question. I was denied contracting because of my credit score, because I was trying to help my daughter pay off her college loans, or I got divorced, or life happened and my credit score went down, so they wouldn't contract me. How do I ever get a contract? Okay, so if you're in bankruptcy, you're not going to get a contract. But if your bankruptcy's been discharged now, they'll just ask for the copy of the discharge papers. You're going to have to go ahead and reapply. It's an automatic process with most companies, so they'll probably still decline you. But I'm looking at my runaway outside the coop here. But once you're declined, go ahead and appeal, because you can't send any of your documentation when you originally apply. All those are just online links. And there's my cat behind you going for my other chicken. So go ahead and apply, get declined, then appeal, then provide your documentation that your bankruptcy's been discharged, and most people will get approved on that appeal. Okay, let's say it's not a bankruptcy issue. Let's say you just got behind on all your taxes or credit cards. They're not going to give you another chance, because people with bad credit, people that are in a lot of financial trouble, make bad decisions. It's shown that they sell bad insurance products and they harm their clients. So sorry, probably not you, but as a rule, they're not going to contract people in that situation. What we need to show is that you have rehabilitated yourself, that you are on your feet again. You still have a lot of bad debt, but you've been making consistent payments. We need to see 2 or 3 months of consistent payments. And that, again, is going to be documentation. So you're going to go ahead and reapply. Your credit score maybe is too low that you're automatically declined. Don't panic. About 50% of people get approved on appeal. And like I said, it's only on appeal that you can send in your documentation. We need proof. You can't write a letter and explain the hardship. You have to show proof that you've been making payments regularly. That there's a pattern of repayment, like I said, at least 2 or 3 months. And then your chances are very good that you will get approved for contracting on that appeal. Thank you guys for your best AEP questions. More questions, call our staff at Gordon Marketing. We're here to help.